Okay, so on today we're gonna do the dressing change for the bottom with our sterile dressing kit. Everything that you're gonna need to do your dressing change is gonna be in this kit, all right? So the first things I have here, I have my orders to verify that I need to do a wet to dry for my patient, and the doctor wants me to clean twice and to pack with 2 4x4s and to cover with the ABD pad. So I'm gonna open this away from me. To the side, and as you can see, I already have my red bag already on the counter. So you want to work where your sterile fill is away from the area of the body. So the first thing I need to do, I need to put on clean gloves because I need to assess my wound first. So I have my clean gloves, and I'm going to pull away from the patient. So the patient's turned to the back side, so I'm going to work from the bottom part all the way up. So I'm pulling back and I'm looking, and I see no drainage, no odor, no consistency. This seems to be a stage 4 because I can see tendons and I can see muscle and fat, and it's healing. So this goes in the red bag. So I'm gonna do hand hygiene, and now I'm gonna get ready for my dressing change. All right, so first thing I wanna do, I'm going to take out my sterile gloves, and I'm just gonna pinch here and set that to the side. The next thing I need to do is take out my sterile drape. So I'm gonna turn my container so I don't cross my sterile fill, and I'm going to lift here. I'm going to step back without this touching my clothes and let it fall, and then I'm going to drape it over. Everything else that's left in here is considered sterile, so therefore I can't touch anything in here until I put my sterile gloves on. So that's the next thing I'm going to do. So I'm going to push this up to the side, and I'm putting on my sterile gloves. I'm right-handed, so I'm going to don my dominant hand first. So my gloves are kind of sticking together, so I'm going to try to release it without contaminating. I'm going to reopen again. I'm stepping away, palm side up. One sterile glove on. Next, I know you all having a hard time with this. You have a lot of working room, so you do have permission to touch sterile to turn it around to be able to get up under the cuff. So I'm going to hold by my 1-inch border so I can maneuver my fingers under here. Step back, palm down, and I'm going to wiggle this to get this in here, as well as my thumb. Now I'm going to stop right here because I do not want to contaminate. So I'm just going to make my adjustments, and from palm to palm, I'm going to get my glove on. Never touch the back of your gloves because that's considered unsterile. Everything needs to be palm to palm when you're touching. All right, so now I'm ready to get started. So I'm going to move this, and I'm going to drop that in my red bag so it can be completely out of my way. All right, now I need to take everything out of my container. So I'm going to stick my hand on the inside because it's sterile to stir, and bring this closer to me. And I'm going to work my way around. So I'm going to start turning this way with this ungloved hand to stay sterile to the side. I don't need this, so I'm going to chunk it. I'm not doing any measurements, so I'm going to chunk that. I do need my ABD, so I'm coming around, drop. I need my scissors, coming around, drop. I'm going to leave this in here because this is going to be for my packing and for my cleaning. So I'm going to turn. I do need this for my 4x4. I have my tape, drop, and I have my solution. I'm going to hold here because it seems like I don't want to contaminate. And then I'm going to come around and I'm going to place that here. The main thing and the main goal is to make sure that you do not cross your sterile field. So I am going to turn this. My two smaller compartments that's here, I'm going to use for my cleaning, and my water compartment I'm going to use as my packing. So the doctor wants me to clean twice, so therefore I need to get 2 of the gauze out. And I'm going to put 2 here, 1 here, 1 here. Now I'm going to come around and I'm going to get my solution. And the label always goes to the palm. I'm going to open here. And I'm going to drop my top there. I'm going to open, drop there. So I'm going to start what's closest to me. So I'm going to pour here. Then I'm going to pour here. And then I'm going to pour here. Therefore, I'm not crossing my sterile field. I'm going to then pick up my top because it's still sterile to sterile. I don't want this to be in my way, so I'm going to walk it back around and I'm going to sit it there. I'm going to come back around. As you can see, this hand is still in the air and it has not touched anything. So now I'm ready to clean. So I'm going to turn my container to the cleaning side. I'm going to squeeze the excess out and I'm going to start with the center. Circle, circle, drop. Circle, circle, drop. And as you can see, I have not turned my back on my sterile field. Now I'm going to go to my packing side. And he wants me to pack with 2 gauze. So I'm going to take 2 gauze out. This is gauze number 1, gauze number 2. And I'm going to squeeze the excess out. In one hand, I'm going to hold this one. I'm going to step back with my gauze in front of me so I can make sure that I do not contaminate anything. And I'm just going to open my gauze. If you feel like you can't maneuver and open up your gauze with both of them in your hand, you can leave one in the container. Okay, and then I'm just gonna flap this over. The wider it is, the better surface you're gonna get. And I'm just gonna place that in there. Step back, and I'm gonna open up my other gauze. And when you're doing your dressing, you want to make sure that the gauze is directly inside of the wound and not on the skin, because we do not want to drag anything inside of the wound as we're cleaning that. So I'm just going to fold this over wide way, and I'm going to place that in the wound. At this point, now I need to cut for my dry 4x4. So I'm coming here. My scissors are here on top of my ABD, but I do not want to cross across, so I'm going to come around. I'm going to pick up my scissors, and I'm going to come back around, and I'm going to pick up my gauze, and I'm going to open enough so I can cover the wound. I'm going to drop this back here. And I'm going to drop my scissors here, covering the wound. Now I'm going to cover with the ABD. So I'm going to reach here, grab my ABD. I'm going to cover the wound. At this point, you can keep your gloves on, you can take them off. I'm gonna take mine off because I cannot tape with gloves on. So you can take your gloves off. And I have my tape here. You want to make sure when you're taping that you don't have a lot of tape on the patient's skin. You want it directly on the pad. So that's my first piece. My second piece, because you want to cover all 4 corners. A third piece, and then on my last piece, I'm going to write my name. So I'm going to put A Turner. Today's date is 10/26/22 at 18:30. This is my last piece of tape. And that's going to go here on the wound. Therefore, you always want to document your work. If it's not documented, then it is not done. And that is the dressing change on the bottom.